Dr. Michael Barnes, your board-certified psychiatrist. Welcome to the medical student lecture on personality disorders. This one is going to be borderline personality disorder, so let's jump right in. Let's go. So I'm going to show you borderline personality disorder basically from the eyes of a psychiatrist. Okay, I'm going to play therapist a little bit, but we're going to show you how I think of this as a psychiatrist. The first thing is that the symptoms are very diverse, and you're going to see that right away. So I'm going to go through the actual symptoms of borderline personality first. The first one, potentially the most important one, is a fear of abandonment. I started out here, so we'll just write like a fear of what? A fear of abandonment. This may be the core issue, and it goes further than that. It's not just that. We're talking about fearing abandonment and then engaging in drastic behaviors that make folks try to avoid the abandonment. Maybe they'll act in a way that's not authentic to who they are, or they'll engage in behaviors that normally they wouldn't because they're seeking the approval of others and they don't want others to leave them. So it may be at the core of most of the issues. They also have chronic feelings of emptiness. Okay, now this could be, they don't have to use the word empty. They could say that I feel hollow, I feel like something's missing, emotionless. Often this is the verbiage that folks with borderline personality describe. They have unstable emotions, so they get emotions that are very, let's just call it mood swings. This is actually the most common symptom. Mood swings, affective instability, basically. So this will often be misdiagnosed as bipolar because of the fact that people see ups and downs, but they don't meet criteria for a manic episode, technically. Particularly anger, and I want to highlight that here. It's actually important to recognize that these emotions and mood swings, they're maybe characterized by anger as a primary thing that they feel. This next one is that they will alternate back and forth between idealizing and devaluing people around them, whether it's friends, family, coworkers, relationships. It doesn't matter. It could be a little bit of a roller coaster, and this is a defense. And by the way, I want to quickly insert here that part of the reason that borderline personality develops is that these are survivors. I want to be very clear. These are people that were often traumatized early on, and this is the way that they cope with the world. Some people cope with the world in other ways, through substances or maybe another thing, and they cope with dealing with their struggles in this way, which is maybe not the best, but I do want to make it clear that these are survivors, and these are often people that will put other people's needs before themselves, and these are very good people. So I just want to take a moment to kind of throw that in there. They have poor self-esteem. I mean, you can't talk about borderline personality disorder without recognizing that there's poor self-esteem, and with that, poor self-image, I'll add, not just self-esteem. This next one is dissociation or a stress paranoia. It's stress-related and it's transient. This is the key here. These are not paranoid people. These are people that get suspicious of their environment when they're under stress. But when the stress is gone, this goes away. I want to be very clear here. So that's this part of it. But then there's also dissociation. Think of it like a checked out autopilot. I can see myself out of my body. I feel numb to the world. Are different forms of dissociation. And impulsivity. This is probably the reason that folks with borderline personality disorder are at risk, because they could potentially do something impulsive. The treatment. The best evidence-based treatment is something called DBT, dialectical behavioral therapy. It's a very specific type of solution-oriented therapy. Its strength is also its weakness. It doesn't go backwards in process as much, but it is concrete, forward-thinking, and solution-oriented. Again, as a psychiatrist, I'll be honest with my viewers, I don't know that I've ever seen somebody with borderline personality disorder who didn't have also depression and anxiety. I think it's sort of the rule rather than the exception here. So my role is to give the patient symptom relief so that they can fight the long-term battle. So depression, anxiety, very often PTSD is there. These are things that often the psychiatrist will have to treat, insomnia, ADHD, and other things. I hope this highlights kind of the difficulties in diagnosing borderline personality disorder and also a different way of thinking about it. Holla at your boy.